Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, knowledge from successful medical practitioners. And today we have a very special guest, Dr. Anand Bhatia, very well known in the world of pediatricians, somebody who has been guiding so many medical students to study pediatrics, as well as guiding them further to clear their specialization examinations. Many medical students, nursing students know him so well. And so he's here to discuss about his journey. How did he get into pediatrics? What are the scope and opportunities in this branch? And if you plan to pick up pediatrics as your specialty branch, what can you expect from the branch? So welcome, Dr. Anand, to the platform. It's really nice to have you here.
Thank you. Thank you so much, Dr. Ayushi. Thank you for a wonderful introduction. And it's my pleasure to be on your channel and so that we can help all the students for the pediatrics.
Definitely. And it's our pleasure to have you here, sir.
Thank you.
Now,
Thank you so much.
Let's start, firstly, a brief of your journey. How did it go, from the start?
Yes. So for the viewers who are watching this for the first time, my name is Dr. Anand Bhatia, and I am MD Pediatrics. I did my MBBS from a government hospital in Bangalore. And then I did my specialization in the field of pediatrics from a hospital, Tirthankar MAHAVEER University. It is in Moradabad. It is in Uttar Pradesh. And now I'm working in a government hospital as the post of senior resident from last 3 to 4 years. So the first question, everyone keep asking me one question, that why pediatrics? Like, why did you choose pediatrics? Why only pediatrics? You can be a surgeon, ophthalmologist, gynecologist. So everyone has their own, idol, or everyone has their own, someone, a mentor or something. So for me, it was my mother. Actually, my mother is also a pediatrician. She is also a child specialist. And I used to see my mother from my childhood, the way she used to treat small babies. And I was very curious, because a newborn is something, they cannot tell you that my stomach is paining. They can't tell you I have a headache over there, I have a pain in my lower back. They can't say you anything, and it's really funny and weird at the same time, that how will you diagnose such stuff, and the mother only complains that my baby is crying and crying. And you have to, like an investigator, you have to start, the whole process. So it was quite challenging for me, and it was and of course I had a little passion also in pediatrics. I love kids, and I think I feel very safe with the kids, and kids feel very safe with me. So because of my mother, actually, I got the whole pediatrics thing in my mind.
That's so nice to know, and I'm sure our parents guide us in the right track. So
Right.
now understanding your journey towards taking pediatrics, how is after taking pediatrics, how is it after that? What are the kind of job opportunities a student can look forward to, after doing specialization in the same?
Yeah, that's a very wonderful question, actually. So the first thing is, I always tell everyone, follow your passion. It is not just pediatrics. Some people, join pediatrics. Some people say for the sake of money they join. Some people join for the sake of fame. Some people join just looking at me, oh, you're doing so well in all the platforms. Let's take pediatrics. Anand sir is taking, I'll also take, like that. So for all those who are in the same boat, don't be like that. Follow your passion. If you want to be a chef, be a chef. If you want to be a singer, be a singer. Like Shreya Ghoshal. If I tell Shreya Ghoshal to do a night duties in ICU, she cannot do that. She's a wonderful singer. So same goes for us and everyone. Follow your passion. If you really have passion in pediatrics, then only you take pediatrics. Just not because your grandmother is saying or your best friend is saying that Anand sir is teaching well, you also take pediatrics. No. Number one, follow your passion. Second, because why? Because the journey has been, kind of ups and downs are there. I hope in your journey also, everyone's journey has ups and downs. It's not every day a beautiful road, If you love the journey, if you love pediatrics, then only, you will feel happy about the pains and sorrows and ups and downs of pediatrics. As far as the job opportunities are concerned, the pediatrics has a wonderful scope. It has a wonderful future. After 3 years of doing of MD pediatrics, you have to do a senior residentship from a government hospital. Like as we all are doctors, you must be knowing that after MBBS, you have to do junior residentship, and after MD, you have to do senior residentship, and then you can apply in various medical colleges. So as far as job opportunities is concerned, there are wonderful jobs as a neonatologist. We also have subspecialties in pediatrics, like pediatric cardiology, pediatric endocrinology, pediatric urology, like that. So job opportunities are huge. It's only that you need to have a focus, you need to have a vision that, like luckily pediatrics is an end branch. Like if I talk about MD medicine, MD surgery, MS surgery, I mean, so today MD medicine is very light. You have to be a urologist, cardiologist, nephrologist, right? And that's another journey altogether, because see, 5.5 years of MBBS, 1 to 2 years of drop, then 3 years of MD, this itself is like around 10 years. And after doing MD medicine, you realize that MD medicine is very light. I need to have a super specialization, another 2 to 3 years. So like 12, 15 years is quite a huge time. So that's why I tell everyone, you need to have a focus. You need to have a vision. Yes, there is a kahawat in Hindi that suno sabki par karo apni. So you listen to everyone, your friends, your uncle, your auntie, this branch is good, this branch is bad. But by the end, what do you feel? You like it? No, I like ophtha. No, I like gynae. No, I like pediatrics. I hate children. I can't see children crying. I have seen people like that, and they joining pediatrics and getting problematic in their mind. So job opportunities are huge as long as you have an interest in that.
Great. So now when you mentioned, just now the NEET PG results are out, and you just mentioned that, you should pick up something that is of your choice, that you can create focus on. It's very commonly seen that people pick up branches with the kind of rank that they get, not maybe because of peer pressure or something. And there are times that people get good ranks and they are interested in some other branch, but they are pushed to take radiology or some of the branches that are top branches. What do you want to suggest on that? Suggest, a bit of deviation, but because as you mentioned about this, if you can guide a bit, because you're a teacher also and you have been doing that.
Yeah, see, life has been a struggle for everyone. Life has its own ups and downs for everyone. First of all, the NEET PG exam, taking a drop, applying for that, not able to get the desired rank, even though if I got that rank, but no, I want only radiology. I don't want anatomy. I got anatomy. This is a paraclinical subject. How will I do it? I'm so sad, So we have this huge emotions in our mind, but again, to be frank, we all know that in the end of the journey, whatever marks we have got and whatever options we have got, the top 2 or top 3 options, so we have to select from that option only. If I don't get a rank, but I love pediatrics, but I did not get a rank. So option number 1, I take anatomy or physiology or biochemistry or microbiology. Option number 2, no, I will drop for 1 year. I'll go for the next year, like that. So again, for all those people, you need to rationalize your mind that can you prepare for 1 more year, because right, something known as next is also coming in 2023. The whole pattern is going to change. It is totally a kind of USMLE or kind of a clinical orientation kind of questions, and I'm already publishing a book on that. So the thing is, like, you need to have a vision and you need to ask yourself, can I wait for 1 more year? No, I can't wait. I've already dropped 2 years. So okay, these 3 options are there. Which one is the best? So that's what you have to choose. If you get on the table whatever seats you get, you have to accept it, and you have to feel that bro, in which one is the one I think I can do it. And I think that's all I have done. That's all everyone can do, because you can't fight for the seat, right? And that's it.
Correct. That's so true. So now, when you mentioned, coming back to pediatrics, when you mentioned about there are enormous job opportunities in pediatrics, and also it's an end branch. So people tend to pick up that branch because that helps you to settle down, and the mainstream branch. What is the kind of, you being practicing in Delhi, it's a lot of opportunities in the tier 2, tier 3 towns as well. So how is it different how did you plan to settle down in a metro despite having so many opportunities in tier 2, tier 3 towns? How do you think, a recently passed out student should make a decision on this?
So that's what I mean. The only reason, one of the very important reason why I settled in Delhi is like I always tell everyone, if you're doing the MD, you do from your native area. For example, I did my MBBS from Bangalore, and the local language we use is Kannada over there, and I took Kannada classes also and everything. But naturally, but still, I will not be able to speak so fluently as a local Kannadiga speaks in Bangalore. So I always had a thing. I was getting very good colleges in South also, but I always had that thing that I want to do my MD from a local language area. I can understand Hindi, I can speak in Hindi, and I can, because see, MD is all about patient-doctor relationship, right? I need to have a consultation, I need to talk to the patient, convince the patient, and so many things. But if I go to a Tamil Nadu, if I go to Telangana, if I go to Trivandrum or Kerala, then it's going to be a double difficult journey for me to understand the local language, explain the patient, are you understanding the local language? It's a huge irritating task. Like we have a lot of in my government hospital also, we have a lot of DNB students and who are from South and this and that. They try to speak in Hindi to the patient, but naturally they may not be able to communicate so well as we do. Itself, the subject is so difficult. Itself, the journey is so painful, and upar se you have this language barrier. So this is one thing I always tell everyone, that MD is something. See, MBBS is theoretical. You learn, go to posting, come back, and question answer types. But MD is purely clinical. It's like you literally diagnose a child and treat a child, discharge a child, follow up a child. So child is going to come to you from A to Z, right? So that's what I think. Taking field, or taking a branch of a local, taking a seat in a state where you are comfortable with the language, that is one thing which you should really think of. I have seen people taking very good colleges but not able to speak Hindi, not able to, I can't speak Tamil, and having so uncomfortable, and there's a bond also, 5 lakhs, 10 lakhs, and they have to pay that bond if you want to take out the seat. So a lot of issues like that. So language is one thing which we should think of before joining.
Okay. And so, okay, you settle down in Delhi because of the family reasons. If somebody wants, if that person has a flexibility to settle down in any place, whether it's a metro or a tier 2, tier 3 town, what is your suggestion to that student?
Yeah, see, and of course, it's a wonderful question actually. But as you know, that Delhi, Bangalore, Mumbai, Pune, all these highly metropolitan and congested cities, but you have the best ventilator, you have the best instruments. In my hospital, we have a huge. I work in neonatology. From last 1 year, I'm working with the newborns. And luckily, we all have the CPAP machine, ventilator, all the latest technology, umbilical venous catheterization, and all those high-fi procedures which we see in the book, which we read in the book. So we do that every day because we have the facilities available in our government hospital in Delhi. But if you go to, naturally, if you go to a little periphery hospital, Ghaziabad or somewhere, little periphery areas, then of course they won't be having so flawless instruments, right? When I did my MD from my state, from the other state, I got the ventilator came in second year of my MD pediatrics. In the first year, we did not even have a ventilator because naturally it's a little periphery hospital. So the whole technology takes time to come to the peripheries. Right. So in that point of view, it's better to do from a busy government or a busy central hospital, which has a better perspective, and you learn better, right? I mean, the whole journey that I want to learn. How can I learn the best? So that's the answer for that, actually.
Okay, great. Nice to know. Now, post MD pediatrics, if somebody wants to go for super specializations, what are the different branches? And if you can, just give your input a bit, what are the best that can be pursued at this point in time also?
Yeah. So yes, there are two very important and beautiful options we have after MD pediatrics. If I have done my MD pediatrics and I want to go abroad, I don't like the life here, money is very less, foreign mein bahut paisa hai, how can I go? What all exams I have to do? So two things are there. Number one, there is something known as MRCPCH. MRCPCH is a license exam for UK. MRCPCH. It is very easily available in all the Google and all the online platforms. Even I also have done MRCPCH. I have started the first part. There's part 1 and part 2. It is basically MRCPCH is only for MD pediatrics who want to apply abroad I want to learn something new, varieties in abroad. So MRCPCH is a part 1, part 2 exam, which is very easy, like not very easy, but it's fair enough actually. It's again like USMLE, it's like a clinical orientation, very smart question. I've taken tuitions also for that, and now I'm giving tuitions for MRCPCH actually. So it's very nice. It's because in NEET and in India, it's little sometimes we say rattafy, or sometimes like just the most common bone to get fractured in a newborn is clavicle. Most important reflex is Muru reflex. Like that, most common syndrome is Down syndrome. So yeah, this is what we have been studying and being taught to us. But no, but in those MRCPCH, it is like very high-fi questions, very smart, very long questions, but genuine questions. I feel I still remember all the questions because they were very to the point and clinical based questions, so you never forget. So option number 1 is MRCPCH for people who are post MD pediatrics. And also MRCPCH can be done for MBBS students also. If you are an MBBS student, but if you have a 3 to 4 years of experience in pediatrics, if you have a post MBBS, आपने 3 से 4 साल किसी pediatrics department में काम किया है, if you work in a pediatrics department for 3 to 4 years post MBBS, you are beautifully eligible for MRCPCH. And post MD pediatrics also, of course, you are eligible because MD itself is of 3 years. So एक तरह से right MBBS और मैंने 3 साल पीड्स में काम किया तो मैं MRCPCH अप्लाई कर सकता हूँ. Second, again a shortcut or a smart way, we have something known as MTI exam. MTI is Medical Training Initiative. MTI का वेबसाइट होता है, गूगल पे है हमारे पास. ये मेडिकल ट्रेनिंग इनिशिएटिव बोल के, दिस इज द नेम MTI. So again, it's for the students who are post MD, and that is something which the foreign universities hire us as a 2 years of fellowship, or a 2 years of kind of a fellowship program they have, which is totally free, which we get very beautiful in pounds, 3,000, 4,000 pounds per month we get. Many of my friends have already gone. If someone wants to know, can put a comment in this section and we'll share the link with you. And so 2 options are best, MRCPCH and MTI. MTI is Medical Training Initiative exam, which is a online Skype interview, and you need to have your IELTS, which is the English test. You must be knowing International English Language Testing System, IELTS, or also OET, Occupational English Test, which is the English test. Basically, you need to cover that, and you can apply for that. For details, you can put a message in comment section. We'll let you know.
Okay, great. Now, understanding both of them is really nice. Now there are a lot of, courses and fellowships post pediatrics as well, different branches like, derma, neuro, cardiac. So anything that you want to suggest on that? What are the different kinds of, and what is the recent trend coming in? If somebody wants to pursue, which is the best branches that people should go for?
True. Yeah, that's very right. So again, the first line which I told in the beginning, follow your passion. Follow your passion. MD pediatrics also, like I like neonatology. I love newborns. I am 24/7 surrounded with newborns, and I love taking selfies with them. I love holding them. I love kissing them, loving them, and I have attachment towards them. So that's why my life becomes very beautiful, and I'm living my dream. I feel every day of my life because I love that. So again, for someone who does not like newborns, and if he does a fellowship in neonatology, it's like a torture for him or her, right? So we have multiple options of fellowships. We have this what you called. I'll again share the link if anyone wants. We have this list of IAP, Indian Academy of Pediatrics, IAP fellowships links, like the list we have, which anyone can apply all over India, which is free of cost. You don't have to pay even a single penny. You just have to go and apply there. It's a 1 year or 2 years like that. And this is the first option. We have neonatology, we have endocrinology, cardiology, all fellowships are there. Usually 90% people take neonatology because neonatology, again, it's good, and it's good for money also. Money making is also very good. But again, in the end, it's all about interest, to be frank. I have seen people getting so fed up just because someone told and they took fellow in neonatology and it was difficult. Like, for example, my wife is also a pediatrician. She is an MD pediatrician. She's done a fellowship in PICU, Pediatric Intensive Care Unit, because she loves PICU. She loves the adult, like from PICU is Pediatric Intensive Care Unit, from what you call 30 days of life till 18 years. So that whole is PICU, pediatrics wala part. And I see the newborns, NICU, Neonatal Intensive Care Unit, which is from the newborns to 28 days of life. Only 28 din ke bacche is what I see. I love that. She loves PICU, she loves that. I do not like PICU, and she does not like NICU. So that's the thing. Are you understanding? So you need to love, and She's working in Lady Harding Medical College, and she has like 10 ventilators back to back, and all 10 babies are on vent, and it's a very painful, like difficult what she does in her ICU duties. Just because she loves PICU, she's there and she's able to manage it. If I go there, I'll run away next day only. So again, the bottom line is you need to have an interest, and there are wonderful fellowships programs available all over India, which you can do it.
Great, great. So actually, we have multiple questions regarding the same.
Yes,
Dr. Hugu Lori is asking that if anyone wants to pursue in pediatric dermatology course as well as neurology after pediatrics, if you can guide in both of them.
Yeah, so see, as far as pediatric dermatology is concerned, even I also once upon a time I had a nice interest. We used to have a lot of pediatric derma patients, seborrheic dermatitis, acne, vitiligo, anaphylaxis, a lot of nice. Even one of my junior also from he's one of my favorite juniors. His name is Anurag. He's from Kashmir, so he also has a great interest in dermatology. So again, the thing is like you need to, for pediatric dermatology or pediatric neurology, for little rare subspecialties, there is again NEET SS. You must be knowing NEET super speciality. Next year, next month, NEET SS date is there. I've already applied for that. Anyone who wants to have a particular pediatric neuro or pediatric derma proper fellowship, then we have some options like NEET SS exam, NEET super speciality. In that, you have a very narrowed down 1 or 2 seats we have all over India, and you have to apply for that. So again, same thing, that it all depends on your interest. And my junior Anurag is applying for pediatric dermatology, but it's not that every hospital is not having pediatric dermatology, because it's a little rare. Because for derma, I'll go to someone who is MD, MBBS and MD derma, and I'll go to that fellow. Why I'll go to someone who is MD pediatrics and then only 1 year fellowship in pediatric dermatology? So are you understanding? Derma, I'll only touch for 1 year, but I'll go to someone who is a proper derma MD fellow from last 3 to 4 years. So this here little bifurcation comes. That is why people take less derma, less neuro, more of neonatology, because you were in MD also, you were there with neonates, right? So that's the thing.
Correct. So actually, Dr. Laurie is again asking if you can elaborate a bit on the fellowship part. That will be helpful. Maybe she's looking forward for the fellowships.
No problem. So fellowships, if you are live, then my mobile number is 9999897081. We have a MD and we have dedicated WhatsApp groups we have where the students can ask the questions. As far as the fellowships is concerned, the IAP, there are 2 types of fellowship. One is IAP fellowship. IAP is Indian Academy of Pediatrics Fellowship. I have a PDF list. Later, I'll share it in the group, where in India, what all colleges are allowing the IAP fellowship to be there. And as I'm MD pediatrics, I can go to the respective college and apply for the fellowship program. क्योंकि वो 6 महीने में एक बार निकलते हैं, like August, September में एक batch निकलता है, March, April में एक batch निकलता है. Gangaram Hospital, Dr. Anand is there. He's a pediatric nephrologist. I spoke to him also. There's a wonderful pediatric nephrology program is also there. But again, it depends, which college is best for pediatric nephro. For Shri Gangaram Hospital in Delhi is best for pediatric nephrology, and they have a huge amount of patients and huge workload and huge exposure. So it all depends, and I have a list of 5 where we have respective colleges, which gives, in Gurgaon also have few medical colleges, private, which gives fellowship in various these things, and accordingly you can apply. It's like that.
So she's again asking, sir, what is the scope after diploma? Because can't get into DNB and MD seat.
Yeah, so that's a tricky question. That's a very tricky question. Every day I'm getting so many messages on WhatsApp and Insta and Facebook that, because NEET result is almost out, and you know that, yes, right? So, sir, mera itna rank aaya, can I get it? Sir, I got this rank, should I wait? And this and that. So, how to say, like, of course, the first priority will be MD, if you get an MD seat. If you don't get that rank, then second priority will be DNB, which is Diploma in National Board, the full form DNB, Diploma in National Board, which is again a very good branch. Of course, MD is MD, then we have DNB. And of course, Khudana Khasta, I am not able to get an MD, I'm not able to get a DNB, but I'm only getting a diploma. Now what to do? So now what to do? The answer is this my first attempt? Question number 1. Can I wait for next year? That is second question, which you need to ask to yourself. No, I am a very fresher. मैंने तो बस 2 महीना पढ़ के ऐसे ही दे दिया. I am a fresher. Just 2 months I just studied and I gave the exam. I think I can do again. I think I can take a proper coaching classes or some faculties. I can take offline classes and I can prepare well. This is for someone who just took 2 months back. Are you understanding? I have so many juniors of mine who just recently passed out their MBBS and they just gave NEET PG. So it all depends. Is this your first try? Was that try genuine? Did you really work hard and you 6 months, 8 months, pura padke, now you got this? And if you have worked hard, if you have given enough time and you got diploma, then of course diploma is our best option. Then of course, because in the end, it all, to be frank, I tell you, it depends how well you can do yourself best also. MD, DNB is just a degree, right? But I was the topper in my class because I was good. That's why I was a topper, not because I'm MD. I work really well. That's why I'm very good. So that element is something your smartness or your sparkleness. Are you understanding? So diploma is also fine if you have worked really hard. If you have waited long enough, it's fine. You give your best shot. You give your super best shot. And this is not the end of journey. After diploma, you can do secondary DNB. There are a lot of other options. You can apply something else later. Are you understanding? So if you have a genuine interest, number one, and if you have waited enough, sir, I can't wait next year, sir, बहुत हो गया, मैंने बहुत बार try कर लिया, then take it. भगवान का नाम लेके take it.
Correct. So Dr. Das is asking, sir, which fellowships are good if there is no particular preference?
Neonatology is best. Neonatology is best. Why? Number one, neonatology, if you do fellowship, number one, there are so many hospitals who apply. Fortis, Shalimar Bagh, Apollo, Medanta, all private hospitals have wonderful fellowship programs. And of course, they have the best technology. They have all the vent, ECMO machine, everything is there, everything they have. So you get a good exposure. You get a very good exposure because neonatology is very common. So it is commonly available. Pediatric endocrinology, pediatric cardiology. So that is there in specific hospitals. You need to have a list. I am from Delhi, but pediatric cardio is in Chennai. I don't know Chennai language. How will I go? Are you understanding? So these hurdles will come. So in short, neonatology is very nice. It is fair enough and you can take it. But again, don't just take it for the sake of taking. You need to have interest because otherwise next week you will call me and tell कि sir मैं तो वापस आ रहा हूँ मेरे से नहीं हो रहा.
That's true. So Dr. Sai Praveen is asking scope of DM cardiology versus fellowship in cardiology.
So of course, DM is DM by the end of the road. DM is DM. Again, in India, we have this tag, right? DM, he's MD, he's DM. If I talk about just only tag, forget about the knowledge. So DM is like DM only. You get better job opportunities for assistant professor, for associate, for private, government. You get DM is a DM. But again, if you're not getting DM and if you really have genuine interest in cardiology, then fellowship is our best go. Actually, fellowship is a smart way. DM ka seats बहुत कम होता है. DM का ना you have to, it's like a PhD. Like MBBS, you work so hard. MD, you work so hard. DM में आके तो you go mental toll. You go to depression. I've seen people who are in depression. I've seen people who have done DM are still in depression. Because it was so tough, it was so painful. Because in DM, you're a JR only. You're working as a JR. I have in Lady Harding Medical College, DM alternated 24 hours. My juniors, they tell me, I was in Lady Harding last year. They told, sir, alternate day 24 hours karta hai DM. Chhod do MBBS MD wala. I was telling her that my life is so tough. Yeah, they're so hectic duties. She's like, sir, our DM sirs, they do alternate day 24 hours for next 1 year. So how painful it is. I mean, you don't want to live a life like that unless you are like very, very fond of it. So the bottom answer is DM is best. If you're not getting DM, still have a strong interest, then definitely fellow cardio is nice because then it's your journey also, right? Your hard work, your amazingness. वो अपने आप ही ले लेंगे आपको. There are a lot of intensivists we need in various medical colleges. अपने आप ही बात पहुंच जाती है. This guy is very good. Let's take him like that.
Correct. So Dr. Laurie is again asking, can a DNB pediatric guy do adult neurology? If yes, how to approach?
So the first question is, why do you want to do that? The first question is that only, that why a DNB pediatric will go to adult neuro. It's like why I'm going right, then I went left. So this answer, a person only should have who is asking this question, because these two are different journeys, dear, right? I mean, like I was having a friend. She has done MD in microbiology. After doing 3 years of microbiology, she is doing again giving NEET PG. Why? She never liked microbiology, She's like, she had a kid and she's like, sir, मैंने microbiology 3 साल किया. Again, I'm applying for NEET. My goodness, why are you applying now? So I want to do clinical job. I want to do. I want to be a doctor, and I'm not. I am again giving NEET. Are you understanding? So the journey becomes so difficult. Can you feel it? So that's the whole thing. If you're doing a DNB pediatrics, want to go to adult neuro, NEET you can give in. अभी NEET SS में भी दो options आते हैं. NEET SS के exam में there are two options. One is for pediatric NEET SS, one is for adult. So that also option you can choose. There are two options in NEET SS. One is for pediatric, one is for adult respiratory. So you can go for adult wala. That way you can switch on. But again, bro, I mean, like think 1,000 times before doing it, because you need to read the whole books. Are you understanding? These two are different genres. Like that's what.
So Dr. Swara is asking, sir, job opportunities post MD in metros. We keep hearing about saturation in most of the medical branches. Anything that you want to, say on that?
Okay, frankly speaking, there are huge job opportunities. If you sorry, my dog is barking. Yeah, so there are huge job opportunities in Delhi. There is lack of doctors. There is lack of doctors everywhere. In Lady Harding also, today, tomorrow also, if you go, there is a walk-in interview. I'm so sorry. In Lady Harding also, there is a walk-in interview. Everywhere, doctors are lacking. So just saying that it is highly saturated, yes, it is saturated. I agree with you. But the problem is like there's still job opportunities. There are still job opportunities. In my hospital also, we are lacking SR. Anyone who wants a job, please contact me. I will get you job in my hospital. We badly need doctors. So जो दिखता है वो अलग होता है, जो reality में वो अलग होता है. Okay, fine. If you want to, okay, if I say if you want to apply for assistant professor or associate professor, yes, that is difficult because Delhi is saturated and we have limited medical colleges. You have to go to Ghaziabad, Gurgaon, and Faridabad for all those things. But for JR and SR in general, for learning, there are opportunities. That's all I can say.
Great. So apart from that, Dr. Swara is again asking, what are the starting salaries of, and what is the scope after a few years of experience in monetary terms?
Yeah, that's a genuine question she has asked. So the shocking part is salary for MBBS, post MBBS, the salary is 1 lakh per month, and post MD, the salary is 1,10,000 per month. That's it. There is only 10,000 increment after MD, after 3 years of MD in all the medical colleges, government if I talk about. After MBBS, the salary is 96,000 to 1 lakh per month. Any government hospital in Delhi, only in Delhi. Delhi is the only city which is being highest paid all over India. Yes. Bangalore, it is like 60,000, 55, 40,000 like that. So Delhi post MBBS, you get 1 lakh per month, mota. Post MD or MS Gynae or MS Ophtha, anything means you become a senior resident. SR ship you apply after your MD or MS. It is only 1,09,000 or 1,10,000 per month after cutting your tax and TD and everything. So it's like nothing. It's like comparatively to MBBS, it's like nothing. Me and my JR, like she earns the same, almost I earn the same. It is like that. And I'm MD pediatrics. MD I am, So that way, being a doctor, we always say that you have to keep your ego aside. We all think we have studied so much this and that, but to be frank, yes, in India or in general, like doctors are getting little less paid. If I talk about, I only know how much pain I do in my night. You have no idea. So many babies on ventilator, from starting from the counseling to the patient to managing the baby to the deliveries, how busy the government hospital is. 28 deliveries in the night, 35, so many cesareans. Banda to aise pagal ho jaye. So it's very painful. So even last week also, well, I had a night duty. I didn't sleep even for a single second. In the morning, 9 o'clock, my eyes were totally red. And still I got shouting from my consultant because of the some here and there small work. So my JR was asking me, sir, what is our future? Like she didn't sleep, I didn't sleep. Baby, also so sick. So she was asking me, Anand sir, like lifetime, is what we're gonna do? Just for 1 lakh per month, is this just we're gonna do? Is this enough? So I was like, yeah, I know it is very tough. That is why, that's why we all say, doctor's journey is very painful. And second question which she has asked, that after a few years of exposure, what is the scope? Then yes. So again, see, there's something known as hard work and something known as smart work. If you really want to earn money, you have to be smart work. Now, what is smart work? Smart work is that, of course, I join some, private practice or something. If I'm working in a private medical college, because in government, you can't join a private practice. If you're working in a private medical college, then you can, number one, you can join private practice. You can, go into teaching. You can do multiple things like that. So these are options you have. And of course, like I have seen my friends who are working in two hospitals. Morning, they're working in Agarsen Hospital. Evening, they're working in Akshan Balaji Hospital. So it's allowed in a private hospital to work 2 to 3 places. So that's how they earn money. That's how they earn money.
Yes, that's true. So I hope that answered your question, Dr. Swara. So now, with this,
we have nice questions. We have all the viewers are asking good questions.
Yes. So now with this, understanding what is the kind of lifestyle that you follow now. You are definitely into a government job, and everybody knows that, government hospitals are so busy all day, all night as well. So how is that kind of lifestyle with your perspective, as well as if you can add a bit with people who are working in corporates, what is the kind of lifestyle? What are the good things? What are the challenges that a person should have in mind before entering into pediatrics?
Okay, yeah. So, I mean, this question needs a very variety of answers. So, what is if I talk about the bad part or the challenges, it's very tough. Number one. Number two, there is zero personal life. There is 0% personal life. Once you come back to house also, you're always thinking about the child. You're always thinking about the ventilator patient. You're always thinking, oh, I forgot to take that sample. Oh my God, did that sample came? Oh my God, what my ma'am will say tomorrow? Oh God, what will sir will say tomorrow? Even though how elder, big or whatever you become, you always have a subconscious mind thinking and talking about that. So you have a zero personal life, total zero. There's no personal life. It's like food also. I swear to God, like in last many months, I always have my lunch in like 3 minutes or 5 minutes or maximum 9 to 10 minutes. And I swear to my JR also, he's eating food and suddenly labor call will come. So he will leave the food there only and he'll go for the labor call like that. And which is a part of the whole journey. We have automatically accustomed and, have told ourselves that that's how it is, and we always have thanda khana. We always have cold food. Always. I don't even remember when the last time I had a fresh food in hospital premises. If I talk about, so life is, to be frank, life is kind of zero in that terms. The only and only hope which is there is, that's why I always tell every single person on this planet, follow your passion. If you really have passion, then only you can survive. We have seen doctors dying. We have seen doctors doing suicide. We have seen doctors going into depression. Even I also had gone into depression a few years back. Because I was working in some other government hospital. It was so tough. I swear, I can't even tell you. I didn't used to sleep also whole night, but I was so scared next day kya hone wala hai. It's gonna be such a, because COVID time was going on. And the first layer of COVID, how painful it was. Yes. We were in PPE, sweating, this, that, and I'm at home still thinking about next day duty. It's so tough. I can't even go to washroom for 12 hours. It is very tough. I don't know how to tell you. So this is the bad part. This is the bad part of everything. It's like the bad part I've told you, and just this is the 1% of the bad part. 99% I've not told you, because otherwise we have to make a movie on that. So this is the 1% of bad part which we all doctors are facing, which everyone faces. An MBBS student also face. Correct. MD student also face. Even a DM also, super specialty person also will have the same lines which everyone's speaking. The good part is, your future gets secured. You get a good thing. You're a doctor and this and that. The good part is that you become a little smart later. You work into private hospital. You have your private practice in the evening. You're working morning and evening shift there. So you're trying to bifurcate the money here and there, and you are good again. But if you love follow your passion. Like that's the goal. If I love pediatrics, then I'll do. Otherwise, it's hopeless. So that's the good and bad part.
So loving your specialty is very important. What I understand from Dr. Anand.
That's true. I mean, it's tough.
So Dr. Imran is asking how to flourish in our private OPD or chamber practice with time.
So it's easy how to flourish in a private OPD and chamber. Number one, in private OPD, you will have you'll have some specific diagnosis of the patient. The normal bread and butter for pediatrics, if I talk about, is cough and cold, pneumonia, asthma, loose motions, acute gastroenteritis. So, mota dekha jaye, to you have a specific amount of differential diagnosis as far as the OPD practice is concerned. In the private practice, if I talk about, you don't treat congenital cyanotic heart disease. You don't treat a transposition of great arteries on your private practice. You see a murmur, you hear a murmur, you order an X-ray, you see egg on string appearance, you say, "Ki, bhaiya, this looks like a transposition of great arteries, refer to pediatric cardiology, refer to a higher center," right? So same goes with any kind of interstitial, ulcerative colitis, Crohn's, right? So these little heavy diagnoses, you refer the patient. The basic bread and butter which comes to you again and again: cough and cold, pneumonia, asthma, bronchiolitis. If it is too much hot, it's gastroenteritis, diarrhea. If too much of cold, asthma, fast breathing, bronchiolitis, you have a nebulizer machine at your private clinic. And vaccination. Vaccination is a good way of earning money. Vaccination is huge, and you cover from the birth to 5 years of life. That vaccination segment, you can earn good money there. So these are the specific things. And of course, how to flourish: have a infantometer, stadiometer, basic instruments. Whatever cases you see, have a flow chart there. कि nephrotic syndrome का आएगा, तो what should be a flow chart? Fever with fast breathing, fever with cough, feral cyanosis. Whatever patient you see, you go home, make a flow chart, take a Xerox, put on your clinic. So that way, by the end of 1 month, by the end of 2 months, when you have the same patient coming again and again, then your approach is better, your approach is smarter, the approach is faster. So this is a wonderful way of flourishing in a private practice.
Correct. Very nicely explained, sir. So now, when you have been into this branch, how anything that you want to suggest all those students who want to pick up pediatrics now and have an option to also? So what do you suggest? So going for a good college, one or more question, going for a good college, or picking up something in your vicinity, something that, anything that you want to suggest on this?
Yeah, so there was a student, again, we have a huge crowd who is asking the same question, that, "Sir, I'm getting pediatrics in a college, but it is a private college," or, "Sir, patient exposure is less, sir. Sir, I'm getting very far, language barrier is there, sir." So yes, this is life now, and that everyone is gonna face. If I speak Hindi, doesn't mean I'll only get Delhi. I'll get Chennai, I'll get state in Thiruvananthapuram, where there is not even a single person who speaks Hindi. So number one, again, how crazy you are about your passion. For example, when I was in Bangalore, I took Kannada coaching classes. I took 3 years of Kannada coaching classes, and my sir name was Mr. Nrsimha. So he was a wonderful person. He was a Kannada teacher in Bangalore. And I took proper 3 months of coaching classes. I had a notebook. I was so dedicated, and I was to speak fluent Kannada in Bangalore. That was my genuine interest to be in that city, to treat the patient of that city, and to accept the branch so crazily. Are you understanding? So that's the first thing, Aisa nahi ke bhai you go and you say, "Oh, your language is so tough, I am not going, I'll go back to my hometown." So those are fluctuation you should not have in your mind. Okay. So the first thing there only is the language. How badly you want, see, you don't even have to ask me this question. It's just that how badly you want to achieve your dream. If you really badly want pediatrics or whatever branch you have in a specific college, because you might have done some homework, you might have seen which is the best college in Delhi. We have Lady Harding Medical College is very good. Indira Medical College is very good. Even other colleges, UCMS is also very good. Even Deen Dayal Upadhyay is very good. So a student who is a smarter student would have made a list of, "Okay, bhaiya, this colleges are good in this city," and how crazy you are about your passion about that field. Then there is no hurdle. There's a language barrier, I will learn the language barrier. There is a bond after post MD, I think I'll do that. So I will not say that, people asking this question. Okay, and one more thing also, I always tell the students that you call that hospital and make some friends there and ask them how is the patient load. Now that is something which is important. वहाँ ventilator ही नहीं है और आप गए हो वहाँ पे, तो it's kind of stupidity. So how is the patient load? how many patients, like if when I was taking MD pediatrics, before I spoke to the people who were there, JRs and SRs, I asked them, kitne patient, NICU, PICU, how many bed, what is this and that. So this is one homework which we have to do. If your dedicated respective medical college has a simple, kind of a, guideline or kind of a things, a basic narrow things. They have a ventilator, they have a ECMO machine, they have a NICU, they have a PICU, basic amenities. If they have, then you can very well join. So this is something which it's a Facebook, it's a huge word. You can call any medical college, you can make friends with, and there's so many Facebook groups, and talk to them. Yeah, do you have patients in hospital? I think, is it good to go like that? So that's what. That's yeah.
So Dr. Padmavati is asking, sir, what is the scope of fetal surgeon and how to approach it?
Fetal surgery.
Yes.
So fetal surgery is not a topic of pediatrics. Fetal surgery is something like, you can do something like, after MS, obs gynae, we do fetal surgery. Surgery word, when it comes, it is not touching, I'm so sorry, but it's not touching our field. I cannot do a fetal surgery after the MD pediatrics. MS surgery, if I do MBBS, then MS surgery, then I can do pediatric surgery, then I can do fetal surgery, then I can go jump to those places. Even a pediatric surgeon also is not a MD pediatrics. He is MBBS, MS surgery, and then pediatric surgeon. So fetal surgery ka scope, I'm so sorry, but in MD pediatrics, we don't touch that part, to be frank.
That's fine, sir. So Dr. Laurie is again asking, sir, what are the challenges in pediatrics? Few parents are more tense about unstoppable crying of the patient, of the baby. How to deal with such kind of parents while we are treating, as well as sometimes it's very difficult to diagnose the unstoppable crying. How to deal with the apprehensive parents, as well as, with politicians and mass people in the periphery.
Yeah. That's very well put. That's very right question she has asked. As far as pediatricians are concerned, you always treat the parent. You don't treat the child. Our HOD used to say that you don't treat the child at all. You treat the parent. I tell you, like, if a patient comes to me, 2 months old baby, 3 months old baby, mother will give you such a wonderful and long 20 minutes explanation. Doctor, I smashed the potato properly. I उसे खिचड़ी उसे अच्छे से मैंने grind किया, उसका एक चम्मच खिलाया, उसे तभी उल्टी कर दी. Then also I did this, that, and this I did. Like, mother itself is a surgeon and a cardiothoracic surgeon. I feel sometimes the way she explains to me the symptoms like that. So pediatrics is a very sensitive branch, and number one, you need to have a lot of patience. Like, you can write on your forehead, you need to have patience. It's not for someone who gets angry very fast. It's not for someone who is very short-tempered. It's not for someone who cannot understand crying of babies, because in all that chaos, you have to literally go into it. You have to make your ears totally, resistant and immune that the baby is crying or not. You should not, tell your ears not to even hear that, because your journey, your thought, your vision is something else to diagnose a child. So number one, you treat the parent, you don't treat the child. I have seen you counseling plays a very important role. As far as pediatricians are concerned, counseling plays a very important role. If you treat the mother, if you counsel the mother, in the evening again, if the baby gets a loose motion, the mother will tell to her husband, nahi, Dr. Anand had told the baby can get loose motion. It takes time for the medicine to heal up. It will take 3. No, he told me, doctor told me, and this and that. And little bit, if you get away from the consultation, away from the counseling, every hour on your WhatsApp or video call, audio call, evening she'll come and shout at you also. What kind of doctor you are? I gave you, my baby got a LRTI, you gave Augmentin, and maybe my baby got diarrhea. What kind of bad doctor you are? So again, you have to counsel. Augmentin causes diarrhea. The most common antibiotic causing diarrhea is amoxiclav, Augmentin. We need to counsel the mother, madam, for a lower respiratory tract infection, I'm giving you Augmentin, but Augmentin causes diarrhea. Let me give you a Bifilac, let me give you a ORS, or let me give you a zinc. So counseling plays a very important role. So kaise aayega? You need to have patience. You need to relax. And we always say that, like, the parent, like, listen to the parent. The mother has a huge story to tell. Actually, just listen to her like this. I just listen. Like you're listening a love story. I just listen to her like that. And she takes around 5, 10, 15 minutes. She tells the whole story. She wants to vent out. She wants to tell out everything, because she has really worked hard. 9 months she has worked hard. Every second she is working hard. Baby ka potty susu, she is doing 8, 10, 20 times. Her lower back is paining. Her breast, the nipple is getting retracted. Her feed is not coming. There are 1 million issues actually. So you have to have patience. You have to have a kind of strong hold, and you need to be have a eye to eye contact with your patient, and listen to the mother, and lot of patience. After that, once again, you treat the parent, you don't treat the child. So patience is something which comes, and these are the challenges. Again, it's a 1% of challenge which I told you. 99% is another story. Patient on ventilator, patient is bleeding. You need to counsel the attendant. The father will say the same old story. Arey, kal tak to theek tha. Arey, the baby was fine till yesterday. You only have done something. You only have done. Baby was fine yesterday. He was perfectly fine. He was breathing. And how can my child start bleeding? That counseling, that is the most sensitive and most sophisticated part of the whole journey. The patient can do medical legal case on you. There are enormous medical legal cosmetic surgery also for dermatology. Anyone today, anyone can do a case on anyone. So that part is so sensitive. You have to be so wonderful, so calm, composed. Make you have, like, are you understanding? So make the whole family agree and understand that we are working really hard. Every 2 hourly call the attendant. Every 2 hourly they call the father. Show him the baby's on ventilator. Baby is really sick. Baby is really injured. Baby is really kind of sick. Explain them properly. So these all things we do in our night duties, and this is like a thorough process which we do every 2 hourly, every 2 hourly, every 2 hourly. That is why I say being a doctor is very painful procedure. That is why I say it's not easy. It's really not easy. It's really not easy. You have to have a lot of guts, a lot of patience, and again follow your passion. You need to love clinical branch, even though it's medical ICU, surgical ICU. सब जगह ये लड़ाई होती है, सब जगह शीशे तोड़ते हैं और बहुत ड्रामा होता है. तो you need to love it so nicely that you have to इतना सक्षम आप होने चाहिए कि you counsel the father and mother and this and that. Even gynae also, so many fights we have. Any medical, any hospital, government, because huge workload. Gynae patient also every day there's a fight, so we need to counsel nicely and this and that. So these are the challenges we face, frankly.
That's true. That's true, and it's so nicely explained, sir.
Thank you so much.
So now with understanding pediatrics in so much depth, one thing wanted to understand in the end from your life, how do you keep yourself so calm? What is it in your everyday lifestyle that you do that keeps your mental balance and your mental peace?
Yeah, that's a nice thought you have thought, ma'am. So how do I keep myself calm? Number one, I live life. Sometimes in this chaos, in this crowd of so painful journey, we forget to live. We forget to enjoy. I love playing guitar. I'm a very good singer. I go to gym. I'm very good in my stuff. I love my dogs. I love my family. So life is all about balance. uh, I'm balancing my life. I am whatever I wish. Some people say after I clear my NEET PG, then I will join guitar classes. Once I finish my MD, then I will go for a Manali trip. Once I finish my DM, then I'll go to South Goa. So people have dreams which they postpone because they are in a difficult journey altogether. So that's what. So I kind of balance. I live my dream. I do everything. I don't wait for tomorrow. I don't wait for tomorrow. I just like, aaj jana chalo ghumne chalte hain. It's okay because tomorrow you've not seen what's gonna happen. I love reading novels. So everything which I used to do, I used to love in my childhood. I'm doing it every single day. I'm making time, making sure I get some time. And there's a saying, life is that no one is busy. It is all about priorities. It is all about priorities. Unknown number, you pick a call so fast. कि unknown number आया किसका phone है. If your chachi mami calls you, you say no, you're very busy. पूरा NICU is so busy. You don't have time to talk. You're so busy this week because it's all about priorities. But unknown number, you'll always pick up and call. अरे भी unknown number किसका? Let me talk. Who is there? So that's the thing. You need to balance. I've seen people saying, sir, once I clear my exam, then I will live my life. Then I'll be happy. And they don't clear. They wait for 6 months. Then in the end, their whole enthusiasm goes totally down. बिल्कुल खत्म हो जाते हैं. वो डॉक्टर बने ही क्यों? Are you understanding? So you need to balance everything. That's the whole thing.
It's true. That's so correctly said. So in any motivational quote from your end that has been with you since the start that keeps you also motivated?
Yeah, so there was one quote I like. Every day I read a lot of motivating novels and quotes, but one thing which always stays with me is that there is no shortcut to success. There is no shortcut to success. We all have taken the stairs. So there is no shortcut to success. There is no shortcut to success. We all have taken the stairs. You know, students in my classes, they say, "Sir, आपकी class करेंगे तो pass हो जाएंगे क्या? Sir, 2 days if I read your class, will I get clear or what?" No, there is no shortcut to success. We all have taken the stairs. It looks very glamorous, the job and everything. Dr. Anand earning so well. Arey, he's everywhere and this and that. I have 75 WhatsApp groups. I mean, by saying it looks so impressive and so hi-fi, but how painful it is. Have you ever imagined how it's totally free? I'm not getting $1 million from that. I'm not getting 1 rupee from that. Actually, I'm spending my time. That is why I always say doctors' personal space is zero. Every time there's a question on pediatrics, there's a question. I got this much rank. What do you think? Please answer, sir. Please answer. Please answer. So there is no shortcut to success. We all have taken the stairs, and I, in my every class, I say that it's you have to love your journey and love your life. I have seen your mind can be, you can use your mind in a very destructive way and in a very creative way also. So there is no shortcut to success, you know. Like people look at me, no, he's earning so well. Arey, he's always happy. I think pediatrics only is very easy. People have taken this thing that pediatrics is very easy branch because Dr. Anand is very happy with pediatrics. करना ही क्या होता है, बच्चे ही तो हैं, वो कर लेंगे manage, छोटे बच्चे तो, I love small kids. You know, people have this tendencies in the mind, but they don't know the background picture and they don't know the whole process, what will happen. So the bottom line is like, there is no shortcut to success. We all have taken the stairs.
That's so true. And this is, thank you so much for ending this and such a nice note. And this is something that is very, very true. So I'm sure this session has been really helpful to many students out there understanding about the branch. And with you giving us so many deep insights, I'm sure this will be helpful for many students to actually hear this on repeat as well. Thank you so much.
I should say thank you for allowing me and to be a part of your Facebook life and your journey. I mean, I am honored to be with you. Thank you.
That's completely our pleasure, Doctor. So thank you so much, everyone, for joining us today. I hope this session would have been helpful for you. Do share it with your friends and colleagues who plan to pick up pediatrics or want to understand about the branch in depth. Also, do follow us on our YouTube and Instagram channels as well, where you can find all our old videos that can also help you with your career growth. As well as Dr. Anand is there on all the social media platforms by the name Pediatrics by Dr. Anand. You can follow him as well. Let him know any of your questions you have. Let us know as well. We'll definitely answer all of them. Thank you so much, Dr. Anand. Thank you so much, everyone, for joining.
Thank you, Dr. Ayushi, and thank you everyone who was there. I hope you had fun. I also had a great time.
Yes, it was really fun. Thank you so much. Good night, everyone.
Bye.